everyone. So, Norah here from Yoga with Norah. I hope you're all doing okay. I've been asked to do a couple of exercises to help someone who has sciatic pain at the moment, one of my students. Okay, so you are all welcome to watch this video, but just bear in mind that you're doing anything you do on this video, you'll be doing at your own risk, especially if you haven't been to my classes or are not a client of mine. But anyone who takes part in these videos and does the exercises is doing them at their own risk. So I just ask you to be very responsible in your practice, not to push yourself beyond limits, to be at ease with your body and to mind your body as you do your exercises. So as you know, sciatic pain can be horrendous and it's so debilitating. There are, however, a couple of lovely exercises that you can do that might help. So I'm going to show you them now. So the first one, we're going to lie down onto our tummies. So just lie down and bring your hands out in front of you. So this is an actual pose. So you're going to drop your head, so you bring your forehead to the floor and just lay here. Nice outstretched arms, but not stretching too much. Just out in front of you. Your hands on the floor, nice and flat. So we're just going to stay here, taking a couple of breaths, breathing in, breathing out. Just letting our back get some lovely oxygen. Breathe into it. Gentle but deep breaths. And when you're ready, you're going to start to release the left hand, the hand in front of you, and you're going to lie onto your side. Now you still have the right hand stretching upwards, but now it's this way, not this way. So you have your arm stretched out in front of you. I'll just move down so you can see it. So your hand is like this. So here we are. So what we're going to do from here is we're going to get our left hand and place it in front of our heart center. And we're going to bend and relax the elbow. So this will give us stability. So we're going to stay here now. Let the body settle because we don't want to do anything too quick in sciatica. So we're going to bend, slowly bend up the left knee. So some people might only be able to get here with the knee. Some people may be able to get here with the knee. So it doesn't matter how far you come, just come within your own range. That's what's most important. So when you get to the range, so bring your knee up slowly. You can use your toe even to bring you up, to crawl up if it's hard for you. So bring yourself up to a position that's right. So you have your knee bent now. So I'm just putting my hand there so you can see the shape. And you're slightly forward with the hip. So this hand is still long. This hand is in front of you. So this alone is enough of a good stretch for sciatica. Make sure that back leg is straight. So you can just lay here for a couple of minutes even and just really enjoy the stretch. See how it feels. If you have a bit of a pain, you can rub or massage your leg. The best thing to do within this stretch or within this position is to actually press your knee into the mat. So bring your hand back in front of the chest, or you can have it higher up if you prefer. You can have it here. And all you're going to do is you're pressing this front knee down into the mat. So as you press it down and put tension within the knee joint, you'll notice that all of this area, this half of your hip, is starting to open up. So just press and try and stay with that press for about a minute if you can. You'll notice you're getting a lot of lightness in the lower hip and the lower buttock, and the tension is coming a little bit across here, and that's all fine. So just press it. If you feel better having both hands long, you can have both hands long, there's no problem. But press the knee into the floor. So while the knee is engaged, you'll get a lovely relief off of that side. So just stay with it. Breathe deeply in, deeply out. If you feel you've released the knee and you're not pressing anymore, that's okay. Just take another breath and push the knee down, press the knee down, I should say, press the knee down again. And just stay with that pose. Feel the opening of your lower back, feel the pressure lifting off. Breathe into it. With sciatic pain, as I said before, or lower back injuries, nothing should be rushed. So you could stay in this position, just this position, for a few minutes. And just let it do what it needs to do and unfold organically for you. And then ever so gently, when you're ready, you're going to release the arm first, bring it down or bring it to wherever you need. You're going to start to release the leg, so you can either walk the leg down from the feet or you can just slide the leg down. No heavy movements, no fast movements. Now you're going to lay onto your tummy again. Put your two hands under your head and just rest for a second. So this is just to get you settled and comfortable. And here too you can stay as long as you like. So for this video I'm only going to be here for a few seconds, but you could stay here for 2 or 3 minutes if you wanted to. So then we go to the other side. So I'm going to show you from this side, but then I'm going to turn to face the camera again. So the left arm would go long. You would roll over and lay on your left side. You would bend the arm in front of the chest and you would slowly start to raise your knee bit by bit until it's in front of you, wherever you feel comfortable that you're getting some work. You would slightly tip the body forward and you would keep the back leg straight. So I'm doing it this way so you can see that it will open this whole area. It will take pressure off here. You would start to push the knee down towards the floor, press the knee down towards the floor. And this will engage the knee and engage this area. So I'm going to turn now, so I'm facing you. but you can stay where you are. So my arm is long, my hand is in front of me. I'm going to bring up that knee. Remember, everything should be nice and slow. And when I feel comfortable with that knee, I'm going to start from here, from my knee, pressing it slightly down into the ground till I feel I get the pressure I want. Because you might want a light pressure, you might want a little bit deeper, depending on where your injury is. So we're working this area here. There's a lightness in the hip below. And we're just going to stay with this. So just breathe and inspect what's going on in your body. If you need to adjust your hand, you can adjust it up. If you want to fall forward a bit more, you can fall forward a bit more. If you need to pull back, you can pull back a bit more. If you need to lower the leg or bring the leg higher or more forward, do what your body is asking for. Do what's feeding your body right now. So just stay with it and breathe. So as I keep saying, it's not about the speed. It's about recognizing what's going on in the body, what your body needs, what your injury needs. Be kind to yourself through all your yoga practice. Ahimsa, no harm. Don't rush. The slower and the better you do these things, the more you recognize what's going on in the body. Just let everything unfold its own way. If you feel you're not pressing your knee in anymore, press your knee in a little bit more. And notice a lovely feeling in your lower back. So stay there for a moment till I get ready for the next position for you. There we go. So we're going to do a pose. I'm going to get in it so you can see where your heels are out. So you're on all fours and your feet are going wide and you're going to sit in between your feet. Now a lot of people find this hard. So if you find it hard, what you do is you get a pillow or a blanket, or a rolled up blanket, and you put that in between your wide legs and you sit on it. If you have tight thighs, this will be where you need a cushion. So I'm going to start again to show you. So let's bring you up. We'll start from here. So the way to do it is come up on all fours first, knees out, and then bring your heels out. Yeah. So when your heels are nice and wide, ease your knees in a little bit more so you have a gap. Okay. Get your cushion, put it here, sit on the cushion so you're slightly raised up from the ground. If the cushion isn't enough, get another cushion or a blanket to build it up, because you have to be in a place that is comfortable. So I'll wait for a second while everybody gets their cushion, because that's what's more important, that you're all in the right place. So my legs are out. So what I'm going to do is I'm going to put my 2 hands in front of me and I'm going to walk just gently to the side, not too much. So when your knees are bent like this, there's less pressure on the back. There is a little bit more pressure on the knees. So if your knees hurt, you can, adjust them. But don't go into the position. Pause the video until you feel completely comfortable. Then we're going to walk back. And we're going to go to this side. And we're just going to stay here, that's all. Just breathe in. Come back to centre. So now we're back in the centre. I'm going to do it one more time. So let's go for our adjustments. So we want to make sure our spine is tall and straight. So breathe in, nice tall spine. Then our head should be nice and relaxed, our shoulders relaxed, and we're going to walk just to the side to give us a slight twist. It's only a slight twist we want. You can go with it, or you can leave your head at the front, whatever suits your body. Go back. So as you can see, it's quite a light stretch, but it's very powerful. So make sure you don't overstretch. Only go within your own range. Back again. So that's loosening here gently. So we're going to go on to all fours again. So gently come up. So place your hands on the floor so you take the pressure off the knees. You're going to come onto all fours and kick your pillows away. We're going to breathe in, bring up the shoulders down with the head. Bring the hips slightly in. We're going to breathe out. We're going to start to bring the belly down, bringing the head up, bringing the hips back. Breathing in, up. Some people breathe out when they go up, some people breathe in. So do what suits you better. Breathing out, up. So just have a little movement around here, some circles with the hips. Get yourself nice and gentle, nice and cozy. Nurture that back. So we're going down now one more time. Onto our belly. Now let's start flat so you know how to get into the pose. So we're going to bring our elbow underneath our shoulder and then the other one. So we're doing a Sphinx pose. So what we're doing here is we're trying to strengthen and help, loosen but strengthen the lower back again. So what we do here is we breathe in and we lift one of the legs very slightly off the floor, so just slightly. So you'll feel a nice stretch here. And then bring it down. Don't stay up too much, just a little bit at a time. Bring the other leg up. And down. and up and down and up and down. You can do as many of those as you want to. I wouldn't do more than 10 though, 5 on each side, but do what you can. So breathing in and up. Remember, slightly up, not too much. If you go up like this, sometimes it feels like you're working good, but you could strain the back. So you want to be nice and low. You can build up as weeks go on. And down and up and down. So we're going to do one more each side, and then we're going to come to rest. So up, down, up, down. Slide your hands under your head. Rest for 30 seconds to a minute this way. When you're ready, you're going to turn your head the other way. You're going to come back onto all fours. So maybe put your elbows down first so you're not straining your back. Bend up your bottom. Walk your knees in. That will be the safest way. Come up on all fours. Yeah. So from here you can either get up to standing by bringing one leg up first and then the other. So coming up like this. Then walking your hands up slowly. Yeah. That would be the way to come up. So, as I said before, these are what I've always found seems to help with sciatica, but you can add a couple of your own techniques to it if you know other ones that help you. Everything is done at your own risk. So I'm just showing you what I know really, or what I feel could help. But it's for you to decide what you want to do with what I'm showing you. So when you take part in any of my videos, it's all at your own risk. I have to say that for my recordings, which is true, of course. So just see how you go with it. If you have any questions, give me a ring. If there's anything else you'd like some techniques for, any other injuries, because I'm a physical therapist, a neuromuscular physical therapist. If you want me to do a video for you, let me know and I'll try and do it for you. Okay, so I give you all blessings and light from my heart to yours. Enjoy your day. Namaste.